Namaste, and welcome to our continuing series on homeopathy with our beloved Dr. Pachegaonkar. Could we talk about stars as a continuation of our wounds?
See, whenever there is discontinuity in the skin, the gap is replaced by a scar tissue. It's a fibrous tissue, and in wound, this is the terminal part where the scarring matures. Like if the gap is filled, then the further scarring is inhibited, and that maturing of scar makes the skin as healthy as it has been, though it may not have hair on it or something, but scar is definitely a replacement tissue for skin which fills the gap perfectly well, even with moderate sensations like touch and all. Only thing is, in some people, if the scarring goes on getting disturbed, like again and again some sort of a mechanical injury or movements, then the scarring is delayed. It takes little more time. The replacement formation is actually delayed by few weeks, but in general, within few weeks the scar matures, and after that it is like a perfect skin. It's a replacement, of course. The luster wise it will be little different, the hair follicles won't be on that, but definitely it will serve the purpose of skin in general. Only one care we have to take is, till it matures there should be no further injuries, because it takes some time to get that original grit like skin or the elasticity like skin. So definitely it's a healthy sign that within 1 or 2 weeks the scarring is complete, the replacement is complete, and then it gets matured. We have seen sometimes beyond 6 months, if the scars are still like growing, then we can term it as a tendency to form keloids. Otherwise, if there are continuous abrasions or mechanical injury which is preventing the scar to get that original grit, it may develop sort of what we call hypertrophy scar, which is more thick as compared to the normal scar. Otherwise, in general, scarring is the perfect process in our body as a part of healing of wound.
But now, cosmetically, many women especially, or if it's in an area of the face or something, would not like to have any scars.
Yes. See, if the wound is healing with first intention in the sense is only the gap which is caused by the injury is to be filled and no secondary infection. That is what we call healing with the first intention. Okay. Their scar would be minimal. Minimum scar, which will be hardly perceptible in gross sense. If the wound is healing with secondary intention, that means with superadded infection, and that infection also consumes a lot of skin around, and that scar can be thicker. But we have homeopathic remedies where scar can be look wise very close to the skin. We have seen especially the scars of the pimples on face, those eruptions.
Yes.
These scars, we have seen that dimension wise, if we see with a magnifying glass, the scars are same. Only the pigmentation, color and luster of that scar area also becomes at par with the skin, and scars are hardly perceptible or not even visible. So the pigmentation on the scar and the skin, if it becomes uniform, they are not seen. So cosmetically it's very important that we always tell that the pimples would be cured, then the scars of the pimples will be cured, in the sense the pigmentation on those scars will be at par with the skin, so the scars will not be visible.
Do you use any homeopathic treatments?
Homeopathic, we for if it is not wound and acne pimples causing these scars, we use Berberis aquifolium, one more remedy,
Oh,
locally as well as internally, and that also has helped so many people.
wonderful. Thank you, sir.